state of care.
Hello and welcome to State of Care Podcast, Episode 6. This show is presented to you by myself, Afra Sefa.
Hello, and myself, Leonard Tanner.
Today we have a very special guest with us, Niven. Ian is manager of Health Watch Brent and has a very important role within the Brent community. His organisation listens to Brent Residents Experiences of health and social care services, things that are good and also things that need to be better.
Ian, with no further ado, we would like to welcome you to the State of Care podcast. Thank you for joining us. Please tell our listeners about your journey and the experiences you've had over the years.
Thank you for your welcome. So I personally have worked in Brent for 20 years, mainly in various charities, doing different projects to help the services and care that people receive in Brent to be better, and certainly in particular to be more individual and more personalised rather than some kind of one size fits all. So I did quite a lot of work, for example, with people with learning disabilities, getting to know them well, working with social workers to think, you know, how can their lives actually be best shaped and to be so that they could have the same opportunities like people that are more fortunate like myself. So that's been my passion, that individual, you know, responsive services really, and that brought me to Health Watch Brent around 4 years ago. Health Watch Brent, its role really is to listen to Brent residents, and as you said in the introduction, to any kind of health or social care service that you receive in the borough. And then we take that information, and we report that and present that information to the people who design your services and run your services. So whether that's your GP, a hospital, a community service, Brent Council Adult Social Care, whatever it may be. Right. And that is our role. So I think a very important bit, and the opportunity I'm really grateful of today, is to let you know that we have that opportunity to amplify your voice and make sure it's heard. But if we don't hear from you, the people of Brent, then we've got nothing to say, no experiences to share.
Fantastic.
Definitely.
Thanks for that, Ian. Just to kind of lead into our first question, what are the challenges you're finding service users are having with the current services being provided?
Well, certainly the most common concern is around GPs and around getting GP appointments. I think about a third of all the concerns we hear around that. But of course that's the service that most people use, so it would be highest.
Yeah.
There are some surprises in there though, because quite often people feel that you can't get a GP appointment to see a doctor of your choice for about 2 or 3 weeks. You know, quite often we hear that story. But in fact, when we go and speak to patients in a GP practice, we find that nearly all patients are getting an appointment within a day or two. So, it's quite interesting. But certainly that, but hospitals, we go and visit Northwick Park Hospital at least once a month to speak to residents in the wards. They're generally very happy with the services they get, but they also raise issues of things that could be better.
Yeah.
You know, and that could be anything from, you know, the lack of a water machine in a long waiting room, to how long it takes maybe at night time for a nurse to respond to a call, you know, from a bed. And the hospital are really good at responding that, and they welcome our independent, you know, role in listening to patients and letting them know. But mental health services, care homes, adult social care, you know, that home care provision you get at home, carers' concerns are certainly some of the key issues and more common issues. But there's such a wide range of health and social care services where our ears are open to all issues.
Fantastic.
Wow.
Fantastic.
What do you guys do? So what does Health Watch do to shape the services that are received by the users in the community? Could you give us some examples?
Yeah, sure. So there's a few things we do. If an individual contacts us and it's an individual issue, then we have a role to provide them with some information and signposting as to where they can get that issue resolved. But if we actually, by going out and listening to different community groups, start to hear a few people saying the same thing, then we'll go and have a deeper dive, a closer look at that, and we'll spend some time in that. So some of the things we've heard from the community over the last year, for example, was people who use British Sign Language as their first language from the deaf community. We're really struggling, at particularly doctor appointments, because they really need an interpreter there to be able to access the service in the same way as other places. So we went in, looked at the websites and spoke to GP practice to find out how good that service was and how responsive. And then we're following up with a deaf group in Brent this year to offer deaf awareness training to GP practices. So we'll see the problem, we'll go and find out, is it really a problem? Yes, they need more information, let's follow up with a bit of action. Last year also up at the hospital, a bit over a year, one of the classic ones we saw was maybe some older patients struggling to eat and struggling with those little plastic straws in the cartons that we all struggle about the best of times. So it was quite painful to watch, and so quite simple things like that make a huge difference, And one of the senior nurses at the trust was really deeply disappointed to hear that was going on. But they did a whole review of the meal service and how they identify older patients and anybody who needs support now gets a red tray of the food, so everybody knows. So that's a really good outcome and a really good partnership working. And it's all about us listening to patients, telling the hospital, and the hospital doing something about it. Fantastic. There are many other projects we do, and listeners and readers can go to our website and see the full range of projects we've done and all the recommendations at www.healthwatchbrent, all one word, .co.uk.
Fantastic, Ian. Appreciate that. Just so to make our listeners aware, Health Watch Brent offers grants for small grassroots organisations. So, Ian, could you tell us a little bit more about Health Watch Brent's community chest and what it does and how it works?
Yeah, sure. So we have small grants, anything from £100 to £400, to help, as you say, real grassroots local community groups who are out there doing a whole range of things to bring the communities closer together, to improve the general well-being of residents in Brent. And these are small organisations that really work on goodwill. They have no money to do something. So we might, for example, if a group wants to organise an event to get more members or for any purpose at all, we might be able to pay for a venue that they can't afford to do, or pay for the food. So it just allows a group to actually do some of that good work that they haven't got the money to do. It's not a great load of money, but it really can make a difference. And then whilst we're at that, we've actually met another group of Brent residents, another part of the community that we haven't listened to, and that's what we want to get into every little nook and cranny and every part of Brent's communities. So we get that opportunity to get feedback from them at the same time. Some of the examples, Stonebridge Boxing Club certainly wanted to do a great big awards ceremony that they knew would be very important to the members and to the self-esteem, that it was a good venue, and we paid for a venue for that. And I think the mayor was there and stuff like that. Cool. So the tribute and Stonebridge Boxing Club, in terms of health and fitness, 90% of the work they do is all around healthy eating and weight control. It's a very, very good contribution they make to society.
So is that funding towards organisations based on health and social care, or would that be towards organisations that support education for young children, or is it?
We're happy to listen to any organisation, and because there's well-being is a very wide-ranging thing, isn't it? So education helps with somebody's future prospects and their well-being. So we'll certainly be open to listening, to them. And I suppose for us, the fact that we get, repeat myself again to say, go to speak to those young people in education. That's great. Yeah. It's not so easy always to hear the voice of young people. It's not so easy to hear from different community groups, let's say from, a range of different African community groups or Caribbean groups or South Asian groups,
Yeah.
Brent has such great diversity, which is part of it. It's,
It's magic, as it were.
But, we need people to come to us, let you know we're there, come and ask for a bit of money, we'll have a conversation, we'll make something happen together.
Really build an inclusive community, right?
Absolutely.
Working together. That actually brings me to the next question, really. We know that you guys, we also know that Brent Health Watch also have volunteers who come and speak to the local community and tell us, so please tell us a bit more about this. What kind of work do you guys do with the local community with your volunteers?
Yeah, so volunteers are really valuable assets, really. Part of the role of Health Watch Brent is to actively engage people in shaping the local health and services. So if people give us their view, that's part of that. But our volunteers go one step further, and they go out to local community groups where they are in their situation and where they normally meet. There might be a group meets regularly or once a month on a Friday morning for coffee or in a community centre, so we're constantly looking for those. The volunteers will come out, explain a bit more about what Health Watch Brent does, and what's the benefit of speaking to us. And again, we're going to get the views of those communities. And if we don't know you're there, but we phone all the time, and we're trying chapping doors all the time. But if people could come to us, and of course we'll always have opportunities for volunteers to come and join our team. I think it's a very rewarding experience for our volunteers. It's very interesting work. They get to understand how the health and social care system works much better. And over the last 3 or 4 years, I think I can safely say that 2 of our volunteers have left into permanent employment after getting the experience that it's a very, very rich experience you can get here.
Fantastic.
And another thing they do actually is, it's a thing called interview. We go in and visit a service, so for example a care home. And the volunteers are trained to go in and speak with local residents, and the training really is all about encouraging people to speak about, again, what's good and what could be better about their services, and to be very observant about what they see. What's the place look like, feel like, what's it smell like, just getting a sense. And because these are ordinary Brent residents, and they haven't been kind of trained in a particular way in health and social care, their approach is very unique to other people who go in and visit. So it's very much about, would I use that service, or would I want a family member to use it? And if I would use it, then what is it that's good about that? And let's share that practice across. And if it's not so good, then what is it? And be really factual. And again, we'll go back to the care home with recommendations. And we do find those care homes are responsive and they make a change. Can I give you a quick example of something?
Good,
So just probably around 4 or 5 months ago, 2 of the volunteers and one of our team, Ibrahim, went to a sheltered housing scheme in Brent. And they realised they were picking up that residents felt quite unsafe in some way. And it really actually was about some antisocial behaviour that was going on.
Sorry, Ian, can I just bump in there? Is that from regular visits, is it? That they've gathered this information, or is it from...
These are one-off visits. Generally, it's a one-off visit. We'll go in. We'll let them know we're coming.
Would you be invited? Would they ask you to come in, or would you suggest?
We tell them we're coming. So we have the right by law to go in and speak. Now, we won't kick the door in to
I hope not.
to do that. If somebody says no, but we'll still report. We'll still report and publicise the fact that for some reason they decided not to let us in. So we expect and people do open the doors. So anyway, as a result of this, it really was behaviour outside. So the sheltered housing scheme installed CCTV and a better monitoring service of that, a monitoring of the front door system, to make sure that both the environment as people came back home and when they were in the home. So I think there'd been alcohol and drug misuse and the environment around.
Yeah.
A better connection, really better reporting mechanism that residents could actually say to the manager.
Yeah.
If there were a need for the police to be called, they were involved in terms of liaising and making that a safer environment for all.
Fantastic.
So, and that happened because these people had volunteered for Brent,
Yeah.
Health Watch. They'd gone, they'd just used the common sense. Maybe people there had got used to it and think that's
that was
normal,
normal,
that's
yeah,
okay.
yeah.
Well, it's not
No,
normal
no.
for you or me.
No, definitely
Why
not.
should it be for anyone
No,
else?
definitely.
So they have a huge impact.
Fantastic.
Wow,
That is
that's
awesome.
actually fantastic, amazing work that you guys are doing there. Really, brings a lot of a better experience to people's lives. Who are not as fortunate as us.
Absolutely,
I
that's
think it makes a
always
huge impact on someone's well-being, to say.
Yeah.
Well, fantastic. Thank you very much, Ian. Well, that's all for today's episode 6. We've been fortunate enough to hear about Ian's personal experiences and the great work that his organisation are doing. Thank you very much, Ian, for coming around and spending time with us. Ian, would you like to tell the listeners where they can contact you?
Certainly. Probably the best place to go and look is our website, which is www.healthwatchbrent.co.uk. And on there you'll find all the reports that we've done and the recommendations, the opportunities for volunteering, for the community chest, everything. If you want to phone up the office, we are part-time. It's only kind of 2.5 of us. Nobody works full-time. But we will get back to you if we're not on the office. Will you call on 020-8912-5831, and really hope that you do get in touch.
Fantastic. And to our listeners, if you have any questions on today's show or would like to participate in future shows, please find us at our website, which is www.totalcareunit.com, or you could send us an email to info@totalcareunit.com, or you can find us on Twitter, which is www.twitter.com/state_of_care. And this has been Leonard Tanner and Afra Sefa. Until next time, goodbye.